Tonight, somewhere between 1 and 4 in the morning, you are going to wake up. Maybe you already know it. Maybe it happens almost every night without you even registering it as a pattern anymore. And in that half-asleep moment, you are going to do something that takes less than 30 seconds. Something that feels completely automatic, completely harmless, and that single action may be placing more strain on your heart than almost anything else you do all day. I'm not talking about what you eat. I'm not talking about screens or stress. I'm talking about how you get out of bed. The habit nobody talks about. For years in cardiology, we've focused on diet, exercise, and medication. But there's a quieter danger that almost never gets mentioned in a routine checkup. And it happens in the dark, half asleep, when nobody is paying attention to form or technique. It's the moment you sit up quickly and swing your legs out of bed to walk to the bathroom. What happens inside your body? Here's what's actually happening in your body during that 30 seconds. While you're lying down, gravity isn't working against your circulation. Blood pools comfortably. Your blood pressure settles into its lowest nighttime levels, and your heart isn't fighting to push blood upward against gravity. The instant you sit up and stand, several pounds of blood volume suddenly need to be redirected upward against gravity, back toward your heart and brain. Why aging changes everything. In a younger body, the nervous system reacts almost instantly. Blood vessels constrict, heart rate ticks up slightly, and blood pressure adjusts within a second or two. But as we age, that reflex slows down. The blood vessels become a little stiffer. The nervous system's response time lengthens, and for a brief window, sometimes just a few seconds, sometimes closer to a full minute, blood pressure can drop sharply before it recovers. Doctors call this orthostatic hypotension, and it becomes dramatically more common after 60, especially in anyone managing blood pressure medication, mild dehydration, or simply a few too many hours of deep sleep. The danger of timing. What makes this even riskier is the timing. Most nighttime bathroom trips happen in the deepest, most vulnerable hours of sleep, when your blood pressure is already at its lowest point of the entire 24-hour cycle. Standing up too quickly during this exact window forces an already fatigued cardiovascular system to overcorrect at the worst possible moment, which is part of why so many cardiac events tend to cluster in these early morning hours. The hidden cardiovascular cost. That brief pressure drop is why so many older adults feel a wave of dizziness, lightheadedness, or that strange tunnel vision sensation right after standing up at night. But the danger isn't just the dizziness itself, it's the fall risk that comes with it, and the added strain it places on a heart that's already working harder than it should overnight. Each time this happens, your heart and blood vessels essentially get jolted out of their rest cycle, forced to overcorrect rapidly. Do that night after night, year after year, and it becomes one more quiet form of cardiovascular wear. Margaret's story. Let me tell you about a patient I'll just call Margaret, a woman in her early 70s who came to me after 2 falls in 1 month, both happening on her way to the bathroom at night. She wasn't tripping over anything. She told me the room would simply go gray for a second, and then she'd find herself on the floor. Her daytime blood pressure readings looked completely normal. It was only when we checked her blood pressure lying down, then immediately after standing, that we saw it. A steep drop that her aging nervous system simply wasn't catching fast enough anymore. We didn't change her medication dramatically. We changed her 30 seconds. The 30-second protocol. Here is the protocol I gave her, and the one I want you to start using tonight. When you wake up to get out of bed, don't sit up and stand in one motion. First, simply open your eyes and lie still for 10 seconds. Then sit up slowly and stay seated on the edge of the bed for another 15 to 20 seconds, letting your feet rest flat on the floor. Only after that pause should you stand, and when you do, stand slowly, holding onto something stable for the first few seconds if it's available. A nightstand, a headboard, a wall. That's it. 10 seconds lying still, 15 to 20 seconds sitting, then standing slowly. The whole sequence takes under a minute, but it gives your nervous system the time it actually needs to catch up, to constrict those blood vessels, raise your heart rate slightly, and stabilize your blood pressure before gravity has a chance to work against you. The results. At Margaret's follow-up 2 months later, she hadn't had a single fall. Her standing blood pressure readings had normalized, and she told me something I think about often. She said she felt like she finally trusted her own body again at night. What struck me most about her case wasn't just the improvement, it was how simple the fix turned out to be. No new prescriptions, no specialist referrals, no expensive equipment, just a deliberate pause built into a moment she had repeated thousands of times without ever questioning it. Sometimes the most powerful interventions in medicine are the quietest ones, making it even more effective. If you want to make this even more effective, keep a small flashlight or a motion sensor nightlight along your path to the bathroom, since needing to squint and adjust to darkness can add its own disorientation on top of the blood pressure drop. And if you ever do feel that gray dizzy sensation when standing, sit back down immediately rather than pushing through it. Your heart works hard enough during the day. The least we can do is stop ambushing it the moment moment we wake up at night. Make this small 30-second pause part of your routine starting tonight, and give your cardiovascular system the head start it needs to keep you steady, safe, and strong for years to come.